Hi, I'm Dr. Malcom Godfrey. I'm an obstetrician, gynecologist and infertility specialist. And today we're going to talk about when should we consider surgery for endometriosis, especially in relation to infertility. So what is endometriosis? Endometriosis is a condition that affects anywhere between 10 to 15% of women. Endometriosis is more common in people that have infertility. The lining of the uterus is called the endometrium. And endometriosis is when those cells, for some reason, are growing outside the pelvis. And those cells still respond to the hormonal fluctuations in your menstrual cycle. So it's like they're having little micro periods inside the pelvis, and those cells can grow on the uterus, on your bowel, on your bladder, or sometimes in the ovary, called an endometrioma. So it's important to understand when we consider surgery for endometriosis. So most of the time when we're seeing women, if they have the symptoms of endometriosis and they're not trying for a pregnancy and we're failing to improve their pain through hormonal methods, usually after about 6 months of therapy, then we certainly look at the option of keyhole surgery or laparoscopy to try and further improve the impact of endometriosis on their lifestyle. So some people, when we're seeing them for infertility, if they have any signs or symptoms of endometriosis, it's important to discuss the option of surgery at that point, because laparoscopy can improve the background pregnancy rate for women who have endometriosis. So treating someone's endometriosis doubles their chances of falling pregnant naturally, usually within the first 6 months. So it's certainly important to explore surgery if anyone has any signs or symptoms of endometriosis. A lot of people do ask what laparoscopy is. It's commonly known as keyhole surgery. So it's a day procedure. We make a little incision in your umbilicus and one just above your pubic bone, and sometimes a little incision off to the side. And that's so we can get our instruments into the abdomen and have a good look around at the ovaries, the uterus, the tubes. And endometriosis commonly looks like little black marks on the side of the pelvis, and we either excise the endometriosis or we can ablate the endometriosis. And most of the time people will go home the same day and can return to work in the next week or two. At the same time, some people will have their tubes flushed as part of the diagnostic workup for the infertility, and this adds little issues to the procedure. It's important when we're seeing people in other aspects of their lives outside of fertility that there's other options treating endometriosis to try and improve some of their pain and their painful periods. So commonly we use hormonal contraceptives, so the common version would be the contraceptive pill, and most people do have an improved outcome with the contraceptive pill. So a lot of the time it's trial and error and finding which contraceptive pill works best for you. Thanks for watching Fertile Minds. For more videos on infertility, please be sure to subscribe.